Hi, I'm Jeanne Wisniewski and I'm a nutritional therapy practitioner. This is the month of October, so this month we're dedicating all of our videos to breast cancer. What can we do to reduce our risk? Or if we know someone or we ourselves are fighting the breast cancer fight, what can we do to make that easier? Through nutrition, through movement, through surrounding ourselves with things that can take our stress levels down. And each week we're going to go through different things that can help us reduce our risk or fight the breast cancer fight even better. So looking at breast cancer, 1 in 8 women will be diagnosed with breast cancer in her lifetime. That's a startling number. And men actually get breast cancer too. So what can you start to incorporate into your diet on a daily basis that will help reduce your risk for breast cancer? And very specifically, I want to encourage everyone to eat carotenoid-rich food daily. What's a carotenoid? That's a long-chain antioxidant that grabs up lots of different free radicals to help reduce inflammation in your body. Carotenoid-rich foods are specifically, they're in most plants, but in high volume in bright red, bright orange, and dark green vegetables. So fittingly for October, they are found in pumpkins. Grab a can of pumpkin puree and start to throw a tablespoon of that stuff in soups and sauces or your coffee, because everyone loves a pumpkin latte this time of year. Avoid, the pumpkin puree is great. Do not get the canned pumpkin pie filling. That has a lot of sugar in it. We want to avoid sugar. But pumpkin is a great choice for carotenoids. Carrots, tomatoes, kale, broccoli, all of those things have a lot of carotenoids. Eat them daily. Your goal is to eat 6 to 9 servings of vegetables a day, every day. We will talk about next week specifically scanning for your skin carotenoid score so you can see where you are. Studies have been done that when you have a certain level of carotenoids in your blood, and you measure this through the skin, your risk for breast cancer is reduced. So again, we'll go over that next week, but start eating these foods that are rich in carotenoids daily. Cruciferous vegetables also have a component, and most of the cruciferous vegetables also have carotenoids, but they also have a sulfur component that are anti-cancer. Very specifically for breast cancer, broccoli has been studied to reduce breast cancer tumor growth. So whether you are at risk for breast cancer or you have breast cancer, start incorporating broccoli every day into your diet. Cruciferous vegetables can be very hard to digest, so I do recommend lightly cooking them as opposed to eating them raw. Helps you to digest them better, particularly if you're going through chemotherapy or radiation. You're going to digest that food better if it's slightly cooked. Carotenoids are also fat soluble, so when you're eating your carrots and your tomatoes and your kale, incorporate a healthy form of fat. Your body will absorb those carotenoids better if there is grass-fed butter or olive oil or coconut oil that is included with it, or avocado, a natural form of fat. Fat has to be present for you to absorb the carotenoids well. You have your cruciferous vegetables, turmeric. Get the spice turmeric and start putting it in your soups and stews and sauces. Turmeric has been shown in lots of different studies to have anti-cancer properties, so to reduce your risk and help your body's immune system as you are actually going through the breast cancer fight. Garlic and onions are great for cellular division. So when a cell has run its course and needs to die, there's a specific component in both garlic and onions that helps it run its cell cycle. Oftentimes if a cell doesn't die when it's supposed to, that can be the cell that turns and starts to multiply at that rapid rate. So those are great. Garlic and onion also have something in them that helps absorb cortisol. So when you're under a lot of stress, and chronic stress can be an issue with breast cancer, that this will help absorb that hormone cortisol that is released when we're stressed. Another thing, the old apple a day will keep a doctor away. So research has been done with apples, but specifically including the peel. So when you eat apples for breast cancer, reducing the risk of breast cancer. Incorporate the peel. Do not discard the peel. Eat the peel. That's where our antioxidants are found. In a higher quantity is in the apple peel. Other things we want to incorporate are pomegranates. So studies have been done with pomegranates that the polyphenols in pomegranates help slow breast cancer, particularly the estrogen receptor positive breast cancer tumor growth. And again, I'm going to include all these links so you can check it out for yourself. Walnuts. Walnuts are a great form of antioxidants that help us fight breast cancer. So of the types of nuts that are helpful for breast cancer, walnut is the nut of choice, and it's shown in mice studies that it slowed the breast cancer tumor growth in mice. Another thing we want to start to incorporate are berries, particularly blueberries and blackberries, that the studies with those have shown to slow breast cancer tumor growth, reduces our risk because of the polyphenols that are also in the darker berries. Another thing is flaxseed. So flaxseed A is a great source of fiber, and fiber helps all of our microbiome and our gut to grow, which helps specifically build a stronger immune system. So flaxseed is a great choice. It also has the omega-3s. Omega-3s are great for cellular structure, for the cell membrane. So you want to incorporate flaxseed. And again, this is something you can get the ground flaxseed. You can sprinkle it into any sauce, soups, stews. You can sprinkle it on top of salads with the salad dressing. It actually tastes great, easy to incorporate, a little teaspoon in here and there to help incorporate flaxseed into your diet. Healthy supply of protein. So I like to try to get or recommend at least 2 servings of omega-rich fish. And when you're choosing your protein sources, I want you to incorporate your cleanest form that your budget can afford. So wild-caught fish are biochemically completely different than farmed fish or sustainable fish. What a fish eats in the wild is what helps it get all the omega-3 quantity in it. When farmed fish are fed largely corn and soy, they do not have the omega-3 content that wild fish do. So wild-caught fish, if you're not a fish person, consider fish oil, but it's the protein specifically I'm looking at fish. So a clean source of protein. And if you are going to use beef, then it should be grass-fed. We want to avoid anything that has hormones added to it that's detrimental, that increases our risk for breast cancer. And if you are fighting particularly estrogen positive breast cancer, you want to stay away from all hormones. Then also we want the biochemical difference of grass-fed animals versus corn and soy fed animals. So whatever your choice is, try to get the animal that's eating its natural diet as opposed to something that helps it gain weight quickly. You know, the antibiotics, the hormones, the corn, the soy. Great for getting big and fat quickly, but not great for all of the nutrient-dense properties that we want from a clean protein source. So consider that when you're buying your meat. Other things that we can incorporate that are anti-cancer are green tea. At least 4 cups a day. It is the catechins within the green tea that help us to, that have the anti-cancer properties to lower our risk for breast cancer or help us if we already have the breast cancer. Other things we want to look at are mushrooms. So it's not any old mushrooms. They're very specific mushrooms. This is a great study, I'm including this, that help with breast cancer. Breast cancer mushrooms are the reishi mushrooms, and I'm probably going to say this wrong, maitake, M-A-I-T-A-K-E, and then the turkey tail mushrooms. All of those mushrooms have been shown in different clinical trials to reduce the growth of breast cancer cells and lower our risk of getting breast cancer. So all of these things incorporated into your diet will help lower your risk. what are some foods we should avoid or things that increase our risk of breast cancer? Number one on that list would be high sugar processed foods. High sugar processed foods, number one, cause inflammation. Inflammation is associated with cancer. And number two, increase our risk of gaining weight. So heavier women or women who are above a 25 BMI have a higher risk of developing breast cancer. So I want you to avoid high sugar food for the inflammation, and I want you to avoid high sugar and processed food in that it causes us to gain weight too quickly. Other things I want you to avoid are soy-based food, particularly processed soy. If you want soy, fermented soy is fine, but soy is an estrogen mimic. So particularly for women who have estrogen receptor positive breast cancer, soy should be avoided. For your risk of breast cancer, you want to avoid too much exposure to things that mimic estrogen. That would include soy, hops like IPA beer. A lot of different detergents or soaps can have an estrogen mimic effect. You want to remove as much of that from your life as possible just to reduce the risk of estrogen receptor positive breast cancer. Another thing that has been associated with a higher risk of breast cancer is high alcohol consumption. So by high alcohol consumption, that is more than 1 drink a day for women. Reduce your intake of alcohol. That reduces your risk for breast cancer. Things to avoid: alcohol, soy, and sugar. Things to include: vegetables, fiber, green tea, pomegranates, mushrooms, turmeric. All these different things can help lower your risk for breast cancer. If you have any questions or comments, please put them in the comments below. I look forward to hearing from all of you, and watch for the rest of the week, and we'll put some little recipes and fun things as a fun fact coming along for the rest of the week. We'll see you next week.